last health nugget, we looked at how the body normally handles elevated blood sugar levels. In today's health nugget, we are going to look more closely at type 2 diabetes so that we can understand it better. Every story has a beginning, and the story of diabetes begins at our very own table. There are two things that are needed to begin the diabetes cascade. One of those things is fat, and the other is inflammation. Consuming a diet high in fat is the beginning of the cascade that will later turn into diabetes. A high-fat diet promotes inflammation in the body. Other dietary patterns that promote inflammation include the consumption of processed foods. These are foods that contain sweeteners, white flour, added fats, food colorings, preservatives, and other unnatural ingredients. High-temperature cooking, such as broiling, frying, grilling, etc., can also contribute to inflammation by producing pro-inflammatory compounds. This combination of high-fat diet and inflammation leads to a decrease in the number of insulin receptors in the fat and the muscle cells, and it gums up the receptors that remain. And because now there's fewer insulin receptors or fewer locks on the door, and the remaining receptors are gummed up, it takes more insulin, those keys, to get the transport proteins or the doors opened up so that it can transport glucose into the cells. If you can't get as much glucose into the cells, more glucose remains outside of the cells, and the blood sugar levels remain elevated. In response to the greater need for insulin, the beta cells in the pancreas increase their production of insulin in order to keep the blood glucose levels down. Unfortunately, the same combination of high-fat diet and inflammation damages the beta cells in the pancreas, eventually limiting their ability to produce insulin. Over a period of years, the pancreas must produce more and more insulin to try to keep the blood sugar levels down, but over time the pancreas becomes less and less capable of producing a sufficient amount of insulin to keep the blood sugar under control, and the blood sugar levels begin to rise. Initially, the blood sugar levels increase after meals as there is not enough insulin to take care of the larger glucose load after meals. But as the disease process continues and the fasting blood sugar levels begin to elevate. Why is this? Well, remember, under the influence of insulin, the liver stops making glucose and stops breaking down stored glucose. As the liver becomes resistant to the insulin no longer is able to stop the production and release of glucose, and so the liver now produces and releases more glucose even when you're fasting, thus your fasting blood sugar levels go up. As the insulin resistance increases and the insulin production decreases, blood sugar levels start rising out of control. This is one more major cause of diabetes that we need to consider, and that is that the body's own fat tissue, especially fat around the abdominal organs, produces chemicals that cause insulin resistance. The more fat one has, the more of these chemicals are produced and the more insulin resistance one has. That's why we see much more diabetes in those that are obese than those that are not. So, in type 2 diabetes, the cells of the body become more and more resistant to the function of insulin, causing blood sugar levels to increase. In time, the beta cells of the pancreas become less able to produce sufficient insulin. As insulin resistance increases and insulin production decreases, blood sugar levels skyrocket, and one develops signs of diabetes. In our next health nugget, we are going to look at who is at risk for developing diabetes, signs to look for that indicate that you might have diabetes, and problems that develop in those that have diabetes. So keep an eye out for our next health nugget.